All right. Hi, I'm Brian Levy. I'm a partner at Manchester Living and the host of the Manchester Living podcast. The purpose of the podcast is to help people navigate the complex maze of elder care. There is a lexicon of elder care terms on our website at manchesterlivingpodcast.com. Today's episode is on behaviors. But first, I want to take you to the new and noteworthy. Communicating with someone with brain change can be emotional, tricky, and exhausting. This clip depicts a real-life situation, role-playing with Teepa Snow with a positive outcome that I showed on a prior episode that I would encourage you to see as well. Let's go ahead and roll the clip.
It's too cold out here.
I'm
Come
fine.
back outside.
No, I'm not going to do.
Get
You
your
are
coat.
not the boss of me. Just
It's too
quit
cold.
bossing me
I don't
around.
want you to get sick.
I'm fine.
You need
I'll
a
walk
coat.
it
I'm
wherever
gonna
I
bring you a
want.
coat and we're gonna put it on.
I'm not putting it on.
Yeah.
You're crap. No,
No.
that I'm not wearing that. Don't you start this. Don't do it.
Mom, I don't want you to get sick.
Shut up. Mom, what?
It's cold out here.
I'm fine.
You're not feeling chilly?
No, I'm fine.
Wow. All right. 1 second. Look.
Where? Whew.
Look. This was. Yep. You get that?
Put yours on.
All right.
You're cold.
All right. Here you go.
I've got it. Just leave it alone. Think you're the boss of everything.
Super bossy, huh?
Yeah.
That's how it's done. So I am real excited about this episode. Matt Grider with Senior Living Specialist is here. Matt, who are you and what do you do?
So I'm Matthew. I work with Senior Living Specialists here in the DFW Metroplex. And essentially we help families find the best senior living options for their needs in any level, from independent living to assisted living, care homes, memory care, anything they need.
Wonderful. Dr. Gentry, who are you and what do you do?
I'm Maudia Gentry. I train community health workers for the state of Texas. Community health workers are considered paraprofessionals. We've seen a lot of opportunities for them right now. Community health workers are navigators for communities, for services. You're seeing a lot of them work in the physicians' offices. They help patients across the board find services.
Wonderful. Welcome. Thank you both for being here.
Thank you.
Absolutely. All right, let's tackle this difficult subject of behaviors in our elder community. Behaviors include paranoia, delusions, depressions, hallucinations, suspicion, impulsiveness, recklessness, hoarding, agitation, aggression, cursing, yelling, spitting, anxiety, and overall non-compliance. I know that sounds like a list from when we were kids, but it's now happening in our elder population. So some of the causes could include pain, most significant in people living with brain change, a UTI or other infections, dehydration, diagnosed brain change, vision or hearing issues, and medication side effects. Are there interventions that are available and effective, such as medications or restraints to help when behaviors are occurring? Matt, you want to go first?
So, environment can make a big difference. Being around the people that they love and trust can be key, whether it's family or caregivers that they've developed a bond with. Medication management is certainly a big part of dementia care. And really just the redirection techniques and kind of learning the language, like we just mentioned, is really key. So just trying to educate yourself on ways that you can redirect a person that's living with brain change.
Great. Dr. Gentry?
Well, one of the things you want to do, I think a lot of it lies with the family, beginning to really help them understand what's happening, how it's happening. Start to teach them different interventions so they are not so confrontational, and begin to work with them, and then begin to ask them, what are they already doing? Work with their physician, and even sometimes bring in another trusted person that individual trusts to kind of take the edge off of all of that.
And the key is to really learn the language. In the previous episode with Teepa, we talked about communicating with people with brain change.
Yes.
And it is a language.
Yes.
It's like learning algebra or Spanish or French or dementia or brain change speak.
That's true.
Yeah.
That's very true.
Let's talk about a situation. What do you do when an elder lies to their doctor and they won't let family or caregivers go with them to the doctor? So the doctor really doesn't have the full scope of what's happening.
One of the things that you want to do is really help that individual see that we're working as a team here. This is a team effort. So mom and dad, you don't have to, not tell me when your appointment is, but just really reach out to them and just kind of back off and just kind of gradually talk about that conversation and just ask them, do you mind if I go with you? I'll just quietly listen. And then you can start to have a relationship with that physician and help mom and dad to feel more comfortable that they're not being judged or you're not they don't feel like you're spying on them.
Right. Are there cases where it would be appropriate to ask your loved one for permission to talk to the doctor and give the doctor permission, just so we can all be on the same page? And now you have a dialogue direct without your loved one present.
Yes. Always do that. A lot of times the individuals feel that you are treating them as children, or they still see themselves as mom and dad, and you are going to always be their child. Right. So when you come into their territory, and that's their territory, then that's going to be a challenge, and you want less challenges as possible.
Matt, you want to add to that?
Yeah, I mean, there's certainly some times where, I've had families in the past that I've worked with where I've told them reach out to the doctor and understand they may not be able to tell you specific information with HIPAA, but, if you've certainly got medical power of attorney, but reaching out to the doctor separately and saying, hey, I'm, my mom or my dad's power of attorney, and there's some brain changes going on, and I want to give you what I know of things that may be going on.
That's interesting. I never thought of that. If you're medical power of attorney, do you need your loved one's permission to be in touch with the doctor? It's a legal question, but
there's power of attorney really takes place, is my understanding, when that person becomes incapacitated. So again, the doctor may not be able to say, here's mom's diagnosis, here's the medical information on mom, because mom hasn't given me permission to share these things with you. But I think you're always good to share the knowledge that you have with the medical provider, just so they kind of get maybe a bigger picture of what could be going on.
Full scope. All right. Behaviors really include, I know in our world at the assisted living care home, showers. Showers are an issue. As our director of nursing, Sandy, always says, people in that generation aren't accustomed to showering. That generation, they went to the beauty parlor to get their hair set. And so the feeling of water flowing over their head is foreign and not comfortable, and they're old and cold. Yep. So
that's true.
What do you do to coax them into showering? And what tools and tactics have you used in the past that have been helpful?
First and foremost, don't ask them if they're ready to take a shower, because the answer is no most of the time. So
choices. Staying
away from a yes or no question is good. The answer is almost always no. No requires no afterthought. So that's an easy answer for people that can't put everything together. But tactics I've used in the past, asking a resident is this water too hot or too cold, and getting them into the bathroom and into that environment. Without forcing the shower necessarily. But another one, after our shower, do you want to wear this outfit or this outfit? And you kind of bypass the question of showering. And now it's like, I want to wear that outfit today.
Now they're focused on the pink shirt.
They're making the choice. Yeah, exactly. Yeah. So they're still in control of making the choice. So giving two positive choices, it doesn't matter which one they pick.
So we put salons in all of our care homes. So they're not showering to wash their hair. They're in a chair like they are at the salon, but they still need to bathe. Yeah. Cleanliness is important, which really just the continuation of the question is ADLs in general, to coax someone into doing whatever the task is. You want to further elaborate on just all ADLs?
Yeah, it's all in the approach. So you can't expect someone to jump up and immediately start doing an ADL. You got to talk to them. Sometimes even just a regular conversation while you're kind of going through the motions can help. So it's more in the approach and the time, and then finding out what works. Routine is so important for people living with dementia. The more routine their days are, the more kind of an autopilot that they're living. So they're not having to use the frontal lobe of the brain to make decisions and process information. So it's kind of like we all do. We all live a lot of our lives in autopilot, driving to the office. You don't really think about it. Going to the kitchen to grab a drink, you're not thinking about it. It's just autonomous.
Right.
So the more routine you can be with someone is going to help as well.
And tools and tactics like for medications. We use a lot of pudding and ice cream. Well, the elders like pudding and ice cream, so those things work. Right, exactly. Yeah. So they get in the routine of enjoying a spoonful of chocolate pudding in the morning, not knowing that's their morning meds. You want to add to that?
I want to add just a little bit on to what Matthew was saying. Also, talk to the family about what their ADLs were previous. Because you've got individuals that maybe took a bath twice a week, okay? And now they're in an environment that is expected that they might need to take a bath 3 times a week or 4 times a week. And you talk to the family, and the family said, oh, no, Dad never liked to take baths. He only took a bath once a week. So you need to know a little history about their ADLs if you can get that from the family, because they have a wealth of knowledge.
Sure. Sure. Go ahead.
Well, I was going to say, in their timeline, a lot of the places out there or people will give showers in the morning. A lot of people, and I find especially men, they shower at night when they get home from work, because they've had a long day working, and they come home, and so they don't like a shower in the morning. I'm honestly, I'm kind of more of a nighttime shower person before I go to bed. So, I can imagine myself in the future being in a place, if you threw me in a shower at 7 o'clock in the morning,
it'd be a shock to you.
I don't. That's not me. So, just their routine that they had before. Absolutely.
We're all routinized. Yep, no doubt. Positioning and engaging can be triggers. Dr. Gentry, will you discuss the importance of walking side by side and your physical approach to somebody with brain change and how important that is as they react?
That's very true. You've got to begin to think, how do I approach this individual? And I know that's hard for families many times, because we're still dealing with a parent-daughter, parent-son relationship. But one of the things you want to do is always look in their face, and you want to begin to walk beside them. It's very comforting. When you come around and you approach them, that's not always the case. It might startle them. So you want to make sure that you're always either looking in their face, or you're speaking to them, or walking on the side of them, and maybe just giving them comfort. Mom, Dad, it's going to be all right. I'm here for you. I'm here to help you. Keep saying those things, because a lot of times a lot of changes are going on in the brain at that point.
Sure. We talk about communication's key in everything, right?
Definitely.
Well, communicating with somebody with brain change is important. I always think of, like, when I'm at the dentist, I want the dentist to tell me before that needle goes in my gum.
Thank you.
You want to tell whoever you're working with what you're getting ready to do, or what they're getting ready to do.
Yes.
Hey, we're going to transfer you from the wheelchair to this nice, comfortable chair. We're going to work together on this, rather than grabbing the gate belt and just tossing them in the chair. That's not what you do, right?
You can't, let me say, you shouldn't do that.
Thank you.
Let me go there. Let me say that. You want the relationship. You want to build a relationship. How do you build a relationship? But like you said, telling them, asking them, bringing them into the conversation, not you just coming in and said, okay, we're about to move you from the bed to the chair, and that's it. No, that individual feels like, okay, you're treating me as a child again.
Right.
Please come to me, tell me. And if you notice, when you talk to patients and you say, we're going to move you, a lot of times they will try their best to help you move them.
Yeah.
But once again, it's all about communication.
That's great. Matt, you want to add to that?
Absolutely. Asking them to help you is a big one. People are typically ingrained to want to help, especially guys. Guys are they're kind of that
prideful
way. So yeah, I used to train with caregivers. You might have a 200-pound, 250-pound guy, big guy, but you get a female caregiver. And the best thing to do is, hey, Mr. Smith, can you come help me with this? Yeah, absolutely. I'd love to help. So it's sometimes just, getting them to follow. But
Matt, sometimes getting our elder community to eat and drink is difficult, but it's so important. Nutrition and hydration are vital. What are some tools and tactics you've used in those situations?
Absolutely. So I think one of the big things that I see is, giving someone a meal, but then they're sitting there by themselves to eat, and that's not normal for most people. So sit and eat with them. Even if they don't start eating first, sit down and you eat. And it may take a minute, but usually they'll start, and you're having a conversation, so they may not be thinking about it. They're engaged in a conversation, but now they see you eating and they start eating or drinking. You can't just give someone water and say, you got to drink this. So doing those things with them, I think helps a lot.
So you talk about mirroring their behavior.
Correct.
Almost being empathetic.
Correct.
And saying, well,
Absolutely.
I have felt that way before.
Mm-hmm.
I'm not real hungry, but I know I need to eat. I know I need to drink.
Absolutely.
Yeah. Dr. Gentry, any advice you want to add to that?
I think that also goes a little deeper to interpersonal skills.
Uh-huh.
You've got to pull out those interpersonal skills that you have in order to work with these individuals. And that might mean, like you said, sitting down with them or maybe watching your body language. People pick up on your body language. If you are welcoming and your eyes say, I want to help, then guess what? I might just sit there and eat with you. But if you're not, we might have a problem. So a lot of your interpersonal skills need to come out as you are being a caregiver and learning to be a caregiver.
Right.
You learn.
Always learning.
Yes.
And it starts with a smile.
Mm-hmm. It does.
Yeah, that's welcoming.
Mm-hmm.
So
It does.
that's great. A lot of information to unpack here, guys. Final question, Matt, what haven't I asked you that I should?
Oh my gosh. Maybe some more tips of the trade I've picked up over the years with some difficult behaviors. I know we discussed, yelling or screaming or getting loud when they're agitated. One of the things I picked up over the years was telling them, hey, the baby's asleep in the room next to us. We got to be quiet. They might still be mad. They might still be cussing at you, but
they don't want to
at least they bring it down. But nobody wants to wake the baby.
Right.
If someone grabs you and won't let go, that's a pretty common one. From an aggressive standpoint, tell them you got to go to the restroom. Surprisingly, that's a really quick, oh, okay. Makes sense.
Right.
So just, you just got to figure out what works for that person and then stay consistent as a caregiver. And you got to keep your cool. That's the big one. You can't lose, your anger or getting frustrated with them. Because it's not going to work. It's not going to help.
We've talked about the consistency and the importance of communicating properly with somebody with brain change. I've heard families say, well, I've tried to discipline mom, but she doesn't listen. How do you react to that? And how can you redirect the family member or the caregiver to better understand you're not going to reason with a 2-year-old toddler. You're sure not going to reason with somebody with brain change.
Yeah, absolutely. That's difficult for families, certainly. I usually with talking to families will say, not to relate your mom to a child because she's certainly not a child, but you got to remember that the deterioration of the frontal lobe of the brain that handles processing information, making decisions, and especially emotional responses. You're not going to discipline them and retrain them. Right. They're losing those abilities. So it's not the same as a child that you're learning and you're growing. Yeah. But they're deteriorating.
There's a phrase I've used on this podcast many times: meet them where they are.
Exactly.
Meet them where they are. Understand where they are and go there rather than try to bring them to you. Dr. Gentry, what haven't I asked you that I should?
A lot of caregivers don't know about respite care. So a lot of times they are at their wits' end. I think we really need to get more information out to caregivers about different programs that are out there that will alleviate some of the stress of being a caregiver 24 hours a day. Mm-hmm. So I talk a lot of times to families that don't even understand that whole concept about respite and how important it is along with self-care.
We all need a break.
Mm-hmm.
Great.
Very much so.
Thank you guys for sharing your expertise and knowledge in behaviors. I know this information will be helpful to families. Let's move on to the nugget portion of this episode. I saw this on the internet the other day and I thought that would be appropriate. Sometimes people just say no. They don't want to participate in the activity. So everybody drew a flower, but not this gentleman. He was out. He said no. Thought that was fun. All right, let's move on to the lightning round of this episode. Quick questions are going to go from Matt to Dr. Gentry and back and forth. Matt, where were you born and raised?
Born in Dallas, raised mostly in Coppell.
All right, Dr. Gentry.
Born in Fort Worth, Texas, raised in Stop 6, Texas.
All right. Years in elder care industry.
Oh my gosh. So 15 with dementia care management and 4 or 5 now with senior living specialists.
Great. Dr. Gentry.
Oh, goodness. Let me say this, several years with working with MHMR, Parkland, the homeless unit, working back and forth with MHMR again, APS. So many, many years. Let me just say that.
Great. Matt, do you play an instrument?
Guitar, actually.
Dr. Gentry.
No, I don't.
Matt, do you stay in touch with childhood friends?
Yes.
Dr. Gentry.
Yes.
Spicy food or plain Jane?
Spicy.
Spicy.
Okay. Call or text?
It depends. Call, probably.
Dr. Gentry.
I do both.
Ever broken a bone?
Luckily, no.
Ever broken a bone?
No.
Me neither.
No.
Favorite ice cream flavor?
Cookies and cream.
Mint chocolate chip.
Okay. Can you change a tire?
Absolutely.
Can you change a tire?
No.
No. iPhone or Android?
iPhone.
iPhone or Android?
iPhone.
Atta girl. Favorite movie genre?
Probably comedy.
Comedy. Romantic.
Karaoke, yes or no?
No.
No. No.
Favorite band?
Oh my gosh. Too many. We'll just say country, mostly.
All right. Favorite band?
Gap band.
Gap band. All right. Last question. Most gratifying part of your career?
Helping families and my years of helping residents. That's definitely.
I love that. Dr. Gentry?
Working in the community, helping families, individuals, connected services, more of a navigator.
I love it. Thank you both for being here. This has been very, very informative. You can find this episode of the Manchester Living Podcast and past episodes on manchesterlivingpodcast.com, YouTube, Facebook, or wherever you get your social media. If there's ever anything I can do for you, don't hesitate to reach out directly. I'm going to have your URLs put up on the screen while we roll into credits. But I want to thank you both again for being here.
Thank
Likewise.
you. Thank you.
Thanks, Brian.